that's me. DD, that's me. DD, that's DD, You wear a hat, they call dad. Me, I'm the dad in a hat. You just like coming in clothes. Me, I like afternoon naps. 3 I be missed for the road. My oldest like counting racks. My middle one, she's in a dirt bike. My youngest is just like a mama. The mama loves me and I love her, so if she wants something, it's never about her. 3 little ladies, my babies, and 1 on the way. Now I'm stressing my mom. And don't try to play around, don't try to play with them unless you're looking for problems. Said don't try to play around, don't try to play with them. My brother's out with the drama. 4 to 5 nights on the road, counting the days till I'm home. I could do show after show, but nothing is better than home. Driving through nights I'm alone, counting the days till I'm home. I've been on road, I'm on go, but nothing is better than home. Clicking my heels like I'm Dorothy. I need new hobbies.
Welcome to Better Than Ever Live, wherever you're watching or wherever you're listening. I hope you're making today your masterpiece. In this live show, we're going to talk about osteoarthritis. And we're going to talk about some common nutritional supplements that might actually help your pain and inflammation and the disease process in osteoarthritis. We'll look at the scientific studies to see how effective these supplements are in arthritis to help you consider if you might take them for your hip or knee arthritis. My name's Dr. David Geier, double board certified orthopedic surgeon, sports medicine specialist, and media medical expert. I help you feel and perform your best regardless of age, injury, or medical history. And as always, please understand, in this live show, I am not giving you medical advice. Everything I say is meant for general information and educational purposes only. And if you have comments, questions about any of the supplements or osteoarthritis or any of the studies we talk about in this show, please leave those in the chat, just like Robert did, who says hello. Hi, Robert. Leave those in the chat. I'd love it if you'd give your first name and along with your comment or question. If you want to talk about arthritis and supplements, I will discuss your comments and answer those at the end of the discussion. If it's about some of the studies we talk about before that, we'll try to do those as we go. So definitely leave those in the comments. Also, just before we get to the topics at hand, I want to say a couple things real quick in case you can't stick around. I will be here tomorrow, 12 p.m. Eastern Time for Ask Dr. Geier Live. So if you have an injury, if you have some surgery that you just went through, something like that you have a question about or want to talk about, definitely join us tomorrow for Ask Dr. Geier Live. Excited to do that, so I will see you 24 hours from now. All right, we're going to start talking about how you can stay young, and one way that will slow the aging process. This was a study published in the journal Aging Cell. Scientists at the University of Arkansas were studying the aging process, but not just like looking at people's pictures and things like that. They were looking at it at a cellular level. And what they found, I'll kind of get to the take-home message, which is exercise can help slow down the aging process. Even if you're 60, 65, and you just now start exercising, that could be a key. Now, what they did, they took elderly lab mice, and wasn't real familiar with how long lab mice live, but apparently they live to around 22 months old. So they took these mice around 22 months old and they had them use this exercise wheel, but not any exercise wheel. It was a weighted exercise wheel to really make them put in an extra workout. And what they did is they monitored these mice after 2 months, and in terms of cellular changes, biochemical changes, those mice that did 2 months of the weighted wheel were basically similar cellularly, biochemically, to mice that were 8 weeks younger than them compared to actually how old they were, which was 24 months. They were essentially like, they had basically taken 8 weeks off of a 22 month lifespan, and that was all because of exercise. And what they figured out was that exercise, again, affects us at a cellular level. It slows down the aging process of our DNA. And what it seems to be is this idea of what's called DNA methylation. Methylation is where you get these little caps, methyl groups that attach to the DNA. They turn on, turn off specific genes, and as you age, you get more DNA methylation. Well, it appears that exercise may limit that DNA methylation, preserve your DNA, and help you age slower. Okay, Next one I want to talk about is junk food and what actually is junk food. We think of pretzels and potato chips and cookies, things that are sweet, salty snacks, desserts, things like that. But maybe there's more out there that in theory is considered a junk food. So what these researchers did is that they looked at all of these different food products that had lots of saturated fat, excessive calories, added sugar, added salt, but weren't considered necessarily junk foods, at least as they've been defined by the different nutritional experts. This was a study published in the Journal of Nutrition, and what they did, looking again at all these different foods people eat, 47% of our calories, almost half, and they were comparing they were talking about all junk foods, all unhealthy foods, according to what the Chilean government considers a junk food. And we'll talk about what some of those are. But on average, our population, the adults and kids in this country, almost half of our calories, 3/4 of the sugar, and almost half of the saturated fats that we eat, that adults eat, come from junk food sources. Now, we talked about the salty beverage or salty foods. We talked about the sweets, the desserts. Sugar-sweetened beverages like soft drinks, more than 40% of the total sugar intake. But it wasn't just things you would naturally consider junk food. This also involves sandwiches, processed meats, ready-to-eat cereals, bread products, all fall into that category of junk food intake. And so I don't use junk food because people kind of think of fast food, but they don't think of things. I look at it more as processed foods. If it comes in a bag, if it comes in a box, most foods that are in the freezer section are all processed foods, and according to this study would be junk foods. But literally almost half of our calories, half of our salt, 3/4 of our sugar, half our saturated fat, all coming from these junk foods. Really, really hard to kind of accept there. And then the last one is one I talked about on TV this week, and that is one about, we actually know, you've probably taken a time off, you go on vacation, you don't exercise, you come back and it's a struggle to get a workout done. Or you get hurt, and now you're able to start working out again, and it's like starting over again. Well, turns out there's actually a physical or really a biochemical reason why. This was a study out of England at the University of Leeds, and what they did is they were able to link low levels of physical activity to the deactivation of a certain protein in our body. They published their research in the Journal of Clinical Investigation, and what they showed was that a lack of exercise deactivates a certain protein called piezo-1, and that is a blood flow sensor. A lack of that active form of piezo-1 basically reduces the number and the density of the capillaries that carry blood to the muscle. You don't have many capillaries, you don't have as much blood flow to the muscle at times of physical activity and exercise. All that exercise becomes a lot more difficult. So in theory, keeping our piezo-1 proteins active by exercising, not only will it make it easier to do on any given day, but it may be important in our physical performance and health. So if you have comments about any of those, definitely leave those in the chat. We'll talk about those. This discussion of arthritis and supplements will be pretty quick, so definitely feel free to comment. We've talked about osteoarthritis a lot on this live show. One of the most common disease processes in the world, one of the most common causes of disability in the world. It's a degenerative disease. Again, I don't like that wear and tear analogy. This is more of an inflammatory process affecting the cartilage, affecting the joint lining, the synovium, causing stiffness, causing pain, swelling, loss of motion. It can affect the hip, it can affect the knee, it can affect joints all throughout your body, your hands, your shoulders, your elbows, all throughout the body. And again, it's an inflammatory disease more than a wear and tear. And it affects the entire joint. It's the cartilage, it's the bone under the cartilage, what we call subchondral bone. It's an inflammation of the synovial lining, the joint lining around the joint. And I've discussed this a lot in Better Than Ever live shows before and some of the videos on my website. This idea that it's a wear and tear process and it's like tread on a tire, it's just not adequate, not a real representation of what's going on. This is a disease. Chronic inflammation that occurs with changes in the immune system. You get this progression of osteoarthritis because of all these different what we call cytokines. These are proteins involved in inflammatory and anti-inflammatory reactions. There's pro-inflammatory cytokines, the bad ones, like interleukin-1 beta, tumor necrosis factor alpha, interleukin-6, interleukin-15, 17, 18. And then there's anti-inflammatory cytokines, interleukin-4, interleukin-10, interleukin-13. The pro-inflammatory cytokines are the ones that damage the articular cartilage. They block the synthesis of proteoglycans, which hold collagen and cartilage cells in place. But those pro-inflammatory cytokines also produce matrix metalloproteases, which further degrade the cartilage and the bone. So we have to stop that inflammatory process. And that's where this discussion of supplements might come into play. What we typically talk about when we talk about osteoarthritis, or if you go to an orthopedic surgeon or regular doctor, they talk about activity modification. Maybe you don't run anymore, using canes or walkers or braces, physical therapy, anti-inflammatory medications, injections like cortisone injections, hyaluronic acid injections, PRP. And then when nothing is helping, what do they tell you? Oh, that you need a hip replacement, that you need a knee replacement. But a lot of people are looking for other treatment options, and that's why that may be where some of these supplements that we're going to talk about come into play. Not just maybe to treat osteoarthritis, maybe it's to prevent osteoarthritis. And when we talk about supplements, what we're talking about are dietary compounds that play a role in that inflammatory process I just talked about before, and all the changes that those create in the bone and articular cartilage. So let's look at a few supplements and see what the research says. The first one we're going to start talking about is one that is used for all different kinds of health benefits, but we haven't talked about it as it pertains to arthritis, and that is fish oil. Studies have shown that people with destruction of the cartilage in their joints tend to have less of that when they take a fish oil supplement. The problem is these are mostly, they're not human clinical trials. It's more animal trials, and they are these cohort studies where you follow people for years and years and years, and then you look back after the fact to see what supplements, what vitamins, what foods they ate, all that kind of thing. We don't have that many human clinical trials. Fish oil, omega-3 fatty acids might be very, very helpful. I would argue it probably is, and there really isn't that much of a downside, but it's hard to officially say that it's good for osteoarthritis because there just aren't that many studies about those specifically. Randomized, prospective, placebo-controlled, double-blinded trials. We'll talk about the problem with research and supplements here in a few minutes. Another category that people know pretty well are what's called glycosaminoglycans. These are glucosamine, these are chondroitin, these are hyaluronic acid. These have been around for 10 to 20 years. Glucosamine and chondroitin are a supplement that you can take. You can get them at any health food store. Hyaluronic acid is injected into the knee. And the data is sort of all over the map. There are a number of studies that show that glucosamine supplements especially seem to improve joint function, reduce pain, may or may not stimulate cartilage regeneration. Some say they do. Some say they help osteoarthritis regress. But there are a number of studies that show that, yes, some people get a benefit, but not everybody does. And it's hard to predict who it's going to be that does or doesn't get a benefit from glucosamine. Fortunately, there's really no side effects, so it could be a viable option. There were 2 randomized control studies looking at glucosamine and chondroitin that show that it does mitigate the catabolic processes, the degenerative processes of the bone, of the cartilage, because of the anti-inflammatory and antioxidant properties. Now, where do you go with this? Again, because some of the studies show it helps, some show it doesn't. If it helps, it seems to improve pain, it seems to improve stiffness. A little harder to see necessarily a regression of the osteoarthritis process and new cartilage formation. But this is one, glucosamine and chondroitin, that does seem to be better or have what's called a synergistic action if you do that with omega-3 fatty acids. So if you're going to do it, maybe you add an omega-3 fatty acid supplement too. And honestly, omega-3s are good for your heart, they're good for your mental health, and I'm about to do a TV segment next week how omega-3 fatty acids are good for your sleep. So you've heard of those. You've heard of omega-3 fatty acids, you've heard of glucosamine, you've heard of chondroitin. Let's talk about one that I had not heard of until I did the research for this, and that is what's called an avocado soya extract. Avocado and soybean oils are used to make soap, and there's let me see if I can say this right, unsaponifiable, I'm sure I'm not saying that right, but a way to make a type of these oils termed avocado soybean unsaponifiable. ASU is what it's called, and it's been tested as a treatment for osteoarthritis. Now, it doesn't seem to do much just eating avocados or just eating soybeans or soybean oils, but people in a randomized double-blind placebo-controlled trial over 6 months looking at ASU being taken by people with hip and knee arthritis, the people that took ASU required fewer anti-inflammatory drugs than the placebo group. By 90 days, 71% of them were taking half the levels of painkillers and anti-inflammatories compared to the ones taking a placebo. So again, just eating avocado, just eating soy doesn't seem to do what you get from this avocado soy unsaponifiable. I don't know, ASU, I can't say it. I don't know why I'm struggling with that word, but it has to be specifically that pre-made supplement. All right, another one that I do know a lot about and I'm a big fan of is type 2 collagen, and specifically undenatured type 2 collagen. There was a study 3 years ago, it was this meta-analysis looking at orally administered collagen using two very common grading scales used in orthopedics. The WOMAC scale, Western Ontario and McMaster University Osteoarthritis Index, and the visual analog scale. These measure pain, knee stiffness, knee function in patients with knee osteoarthritis. And collagen did prove to be effective in osteoarthritis symptoms, both by decreasing the WOMAC score and the visual analog score. So type 2 collagen supplements might be very good. The one I like, and this is not medical advice, but I like a collagen peptide called Collagen. It's got Fortigel in it. It comes from Australia, but there's a company in the United States that has the license to basically use Fortigel, and they make a product called Collagen, C-O-L-L-A, and then capital G, capital E, capital N. I think it's orthomolecular products. We have it in our office. I put it in my coffee. Sometimes in protein shakes. I absolutely love that. All right, and then another one that we've talked about a little bit, and I talk about a lot with my patients, is curcumin. That's from the spice turmeric. Those of you that eat curry know all about turmeric. A lot of people know about turmeric as an anti-inflammatory. Well, it's the curcumin in turmeric that has the anti-inflammatory effects. It blocks cyclooxygenase 2, it blocks the 5-LOX enzyme, so it protects the breakdown of cartilage from, like we talked about earlier, interleukin 1 beta. Curcumin also seems to have a synergistic effect with omega-3 fatty acids, so it might enhance the antioxidant effect, but again, blocking those pro-inflammatory cytokines. There was a study last year looking at curcuma longa extract and curcumin supplements, and one of the things about turmeric, just so you know, just putting a little bit on your food probably isn't giving you nearly enough, and that's where a curcumin supplement may be a little bit better. But this study last year found that a curcuma longa extract supplement, comparing it to traditional anti-inflammatories, ibuprofen, naproxen, found that the curcumin was equally, if not more effective in knee pain, stiffness, osteoarthritis symptoms compared to anti-inflammatory medications, but a whole heck of a lot safer. And then last, 3 years ago, in a journal that I really liked, the British Journal of Sports Medicine, sort of the definitive journal for the primary care sports medicine crowd, there was a study 3 years ago doing a meta-analysis of 20 different supplements for osteoarthritis. It involved 69 studies that made up this meta-analysis, and they found 7 supplements produced large clinically important effects for pain reduction in osteoarthritis. Collagen, we talked about. Another one we didn't talk about, passion fruit peel extract. I'm not really sure where you get that. Curcumin, we talked about. Boswellia serrata, which is one used in India, not a lot here. Curcuma longa, curcumin. Pycnogenol, which comes from the French maritime bark. And L-carnitine. Others helped with pain on top of that. Again, the type 2 collagen, that ASO, avocado soybean unsaponifiable, MSM, which is in a lot of joint supplements, glucosamine and chondroitin. Now, the problem in that study is that none of them really had long-term benefits, meaning you take them for years and years and years. But again, these are supplements. This isn't necessarily completely rebuilding the cartilage, stopping that inflammatory process and reversing it, like we talked about with penisin polysulfate a few weeks ago, things like exosomes and PRP injections that can help with that. But if it can stop the inflammation, it may decrease pain, may decrease swelling, may decrease stiffness, but also doesn't have some of the side effects that a lot of those medications that we use for anti-inflammatories effects now have. Now, I told you the problem with research about supplements, whether it's osteoarthritis and anything else, is money. When there's a lot of money to be made, like in the case of patented drugs that the big pharmaceutical companies put out there and sell for a lot of money, they put a lot of money into the trials because there's a lot of money to be made from it. But there really isn't that much money to be made in supplements. So it's really hard to get these trials done because who's going to pay for it? And that's why a lot of times the research is all over the map. Supplements generally are safe. It's always good to talk to your doctor about interaction with medications you take and things like that. But these are things that you could conceivably try and see if they have any benefits. So if you have any comments, any questions about osteoarthritis, definitely let me know about that. Robert says vitamin D and vitamin E. Yeah, so with both of those, so vitamin E is a strong anti-inflammatory and is good for high blood pressure. It's good for dyslipidemia or cholesterol levels. I did not see any studies on it for osteoarthritis, but anything that provides an antioxidant and anti-inflammatory benefit might have a role. So I agree with vitamin E as a potential option. Vitamin D, absolutely so helpful for so many ways. And in other parts of the body, vitamin D has been shown to have anti-inflammatory effects in the heart and maybe in the brain. Vitamin D is just good for overall health. It's good for your immune system. It's good for bone density. It's thought to be good for muscle strength. So I would agree with both of those for sure. That's all I'm going to get to today. Lavish, if you want to ask me that question tomorrow during Ask Dr. Geier Live, that's when I do orthopedic questions and give answers to that. So join us almost 24 hours from now. Same place on my YouTube channel. Definitely do that. If any of you out there have an orthopedic injury, tendon, ligament, arthritis like we talked about, and you want to see somebody that isn't pushing you towards joint replacement, isn't pushing you towards cortisone shots or things like that, scoping the knee, things like that, somebody that knows about bone and joint injuries in athletes and active people, I'd love to help. Double board certified in orthopedic surgery and orthopedic sports medicine, getting a third board certification hopefully by this fall in anti-aging and regenerative medicine. So I would love to talk to you about all your options. The link to my website, and if you go to the contact page on my website, you can request an appointment. Also, if you want to read the studies we talked about, those should be in the description below as well. All right, that is all I have for you. Again, please remember tomorrow, noon or 12 p.m. Eastern time, Ask Dr. Geier Live. I will be here. I will answer your questions until all the questions have been answered. So it may be a 5-minute show or it may be a 45-minute show, but definitely join us tomorrow. Thank you so much for watching. We have some really good shows next week too. We're going to talk about, I don't even remember what we're talking about. I think we're talking about, I can't remember. It's all good stuff. You'll like it. I think we're talking about thymosin beta 4, TB4 for orthopedic injuries. I know we have MOD-SC coming up, which is a mitochondrial peptide for energy, for athletic endurance, for weight loss, increased lean muscle mass, decrease fat. We'll talk about that. We're going to talk about NAD and NMN, which has come into a lot of attention with David Sinclair's book, Lifespan, and ways to boost your NAD levels, how to prevent the NAD levels that drop as you age. So a lot of good stuff coming up over the next week or 2 weeks. I really look forward to it. Thank you so much for watching. I'll see some of you tomorrow for Ask Dr. Geier Live, and I look forward to helping you feel and perform better than ever. Take care.